Well, the American Society of Hematology is just an extraordinary organization focusing from the bench to the bedside in hematologic disorders and hematologic malignancies. The depth of and breadth of what ASH actually achieves in both of these areas is awesome. I know, and I think this year will be the best ASH ever, that patients will come and that caregivers and researchers will come to hear cutting-edge information in terms of new science, promising science, new drugs, brand new first-in-man experiences, and then further along new strategies. So targeted therapies are going to be very exciting. Precision medicine, genomic studies at a depth and complexity never done previously, and pooling of data in order to understand in our orphan diseases, whether they be the hematologic disorders or the heme malignancies, there's large now collections of data in order to understand the diseases better and ultimately to understand how to treat individual patients better. I think the other major area at ASH will be in the immune area. There's tremendous activity in terms of how, at a basic level, to understand better the regulation of the immune system and how, in preclinical models, to trigger an immune response in patients against their own cancer. These have already translated, as you know, in solid tumors in remarkable progress in melanoma and lung cancer, head and neck cancer, bladder cancer, many cancers. We in the hematologic malignancies have some exciting leads, such as in Hodgkin's disease. In myeloma, we will see combinations of checkpoint inhibitors with other agents, such as immunomodulatory drugs. But the themes of precision medicine and genomics at ASH, and the second theme of immune therapies, I think will be the major emphases this year. The other thing I just want to mention is that with these new developments, we as a community have to be responsible for making sure patients everywhere have access to the medicines they need. And the American Society of Hematology has so many outreach programs. I've just been in Asia and South America where we help to educate the up-and-coming superstars in hematology. We share cutting-edge data, and you cannot be more inspired by this new generation and the commitment of caregivers in those areas and elsewhere to often do the best by their patient in spite of a lack of resources and in spite of lack of access to the novel medicines. So the American Society of Hematology is trying to really fix these problems. We're trying not only to help the next generation of researchers and caregivers in North America and in Europe, but we're trying very much so to bring this expertise to Asia, South America, other areas that might be underserved in order that we can get these advances, so exciting advances, to patients everywhere.